Hello, everyone. Good afternoon. Whew. I am truly honored to be here, and I really want to say how grateful I am to be able to have the opportunity to share my little story. My name is Uzoamaka Okwor. I am a PhD in Epidemiology candidate at the Mel and Zuckerman School of Public Health. I'm originally from Nigeria. And my journey into public health has taken me across continents, roles, and seasons of life. I began my career as a registered nurse with a particular focus on maternal and child health. In my early nursing practice in Nigeria, I cared for a woman with advanced cancer, cervical cancer, who had never once been screened. She was not much older than many women in this room. By the time she had arrived at the hospital, the disease had already taken so much from her. There was little or nothing we could offer her except pain relief and our presence. I remember standing by her bedside during a night shift, listening to her stories about her children and her hope to go back, returning home to be a mother. I knew even then that she would not. I remember leaving the hospital that morning with a weight I could not shake. The quiet realization that something had failed her long before she reached our ward. It still stays with me. It was not only a medical failure, it was a system failure. It was a prevention failure. It was a community failure. That experience stays with me. It still does. It changed me. It was the moment I realized and understood that if we want to save lives, we must intervene long before the hospital. Improving health requires more than bedside care. It requires research, prevention, and system-level change. After she passed, I made the hardest decision of my career. I quit my position in one of the best hospitals in Nigeria to pursue research, and I promise you I had no idea what research was all about. I loved patient care, but I understood that if I wanted and truly wanted to prevent stories like hers, I had to move upstream, beyond the bedside, into the systems that shape who gets sick and who does not. I transitioned into research, first working as a research assistant at the Institute of Human Virology in Nigeria. In those roles, I witnessed how rigorous research could shape health systems, inform policies, and improve the outcomes of entire community. That experience strengthened my commitment to pursuing public health. I then moved to Tampere University in Finland, where I completed my master's in public and global health. Shortly afterwards, I made the decision to continue my training in the United States. When I moved to the US, I was 7 months pregnant. And my first child was 4 years old. Relocating countries while preparing to welcome a new baby and stepping into a demanding doctoral program requires courage, faith, and a clear sense of purpose. There were moments of exhaustions and uncertainties, but I never doubted why I was here. I am now poised to graduate next year, having completed my comprehensive exams, and I maintained a strong academic progress. Each milestone carries meaning because I understood the journey behind it. My research interest is in chronic disease epidemiology, particularly women's health. I'm passionate about understanding the long-term health trajectories of women, ensuring that research reflects their realities of their lives across diverse populations. I believe strong method and thoughtful analysis can help close persistent gaps in preventing diagnosis and care. Receiving the SueBob scholarship has been profoundly meaningful to me. Beyond financial support, it represents trust and belief. Belief in my potentials, in my work, and in the long-term impact of investing in students who carry both ambition and responsibility. It also reassures me that my work matters and that there is a community invested in the future of public health. This scholarship eases financial pressure, but it also provides something less visible and just as important: peace of mind. It allows me to focus on my research, to be present for my children, and to move forward in my training with greater stability. For that, I am deeply grateful. Sue and Bob, I am deeply grateful to you for what you did for me and my family. It will never go unnoticed. May posterity always bless you. Please know, and I mean this from the depth of my heart, that your generosity extends beyond tuition assistance. You are supporting families and supporting research that aims to improve women's health outcome. You are supporting the long-term impact of rigorous, equitable public health work. And in a world where gratitude can sometimes be overshadowed by entitlement, I want to pause and say very clearly, I do not take your generosity for granted. I recognize it, I value it, and I carry it with a deep sense of responsibility and sincere gratitude. I sincerely hope that one day I'm able to pay this kindness forward and invest in the journeys of students who come after me. When I look back on my career in the future, Sue and Bob's scholarship will always be part of the story. It will be one of the chapters that made this journey sustainable. Thank you for your generosity, your belief, and your commitment to students like me. And thank you to the donors in this room. May God and posterity thank you and bless you and reward you for all you do for the students and even the ones you didn't hear their stories. Thank you, everyone.